So look closely here. This is a typical muscle. This is basically the postsynaptic receptor, or the postsynaptic membrane for the neuromuscular junction synapse. So we would have a presynaptic terminal here, right, where we would have all the release machinery and synthesizing enzymes, for the production and release of acetylcholine upon the arrival of an action potential. And here are the postsynaptic, receptors that we find on muscle. They're nicotinic because they are going to be the receptors that are ionotropic that can allow for fast, depolarization of the muscle and contraction. Right? So it turns out in a typical normal muscle, you've got a lot of these nicotinic receptors that are located just across from the presynaptic terminal. But there's a disorder called myasthenia gravis. It's an autoimmune disorder, which means that your own immune system, for some reason, finds something it doesn't like about these proteins, particularly these nicotinic cholinergic receptors, and it starts to attack them. It does so primarily in the periphery. And as it does so, these receptors become far less numerous, and they don't work as well because they're being literally attacked and eaten by components of your immune system. And so patients who suffer from myasthenia gravis actually report significant weakness. They're sending the signal. They're sending the cholinergic release of neurotransmitter at the neuromuscular junction, but the postsynaptic membrane is no longer as responsive, right? And so they have difficulty with breathing. They have difficulty with movement. This is a disorder of the postsynaptic membrane at cholinergic synapses in the periphery.